The Security and Navigation module covers AHLTA Theater security, user accounts and roles, and reviews the basic navigational features to include the AHLTA Theater desktop. The learning objectives for this module include: briefly describe AHLTA Theater security, demonstrate logging into AHLTA Theater, identify AHLTA Theater desktop components and navigation methods, demonstrate opening and closing AHLTA Theater modules, and logging out of AHLTA Theater. As the security of patient data is of paramount importance in the military's healthcare community, an elaborate and effective security methodology has been built into AHLTA Theater. User access to the system is based on the role of the user and is determined when registration is completed. User access levels are created by the system administrator. Thereafter, when the user logs into AHLTA Theater, access to all components required in the performance of their duties is granted. Access to all other components of the system is denied. After registration, users can configure their own desktop, set their own defaults, and create their own favorites list. These settings are tied to their unique username and password. Users can log into any terminal, and those settings and defaults persist. An integral part of AHLTA Theater security is the assignment of roles. Each user is assigned an AHLTA Theater role. This role is determined by the user's job skill set and need to know. Roles are cumulative, allowing greater access to patient information as roles are added. Updates to roles depend on permission from the clinical team member's manager. Similar in concept to the AHLTA user level, an individual's role and need to know determine what information can be accessed or changed. You have just been given an AHLTA Theater account and would like to log in and learn how to navigate the application. You need to log into AHLTA Theater, view the desktop basics, and practice opening and closing a module. To log into AHLTA Theater, double-click the AHLTA Theater icon from your desktop. A security message banner displays. After reading the message, click the Acknowledge button. The Military Clinical Workstation login window displays. For this simulation, you will log in using your user ID and password. Select the User ID field. In the User ID field, you need to enter your user ID. Remember, the user ID is not case-sensitive. For this simulation, enter ERDoc and select the password field. Remember, the password is case-sensitive and should be at least 15 characters long, including at least one uppercase letter, 2 numerals, and 2 special characters. Enter your password: capital O, lowercase n-e, capital O, lowercase n-e, 12345678 $, and then click the OK button. The Military Clinical Desktop opens. The appearance and navigation functions within AHLTA Theater are very similar to the appearance and navigation systems employed in other Microsoft Windows programs. For example, the icons in the top right corner of the screen are Minimize, Maximize, and Close. The AHLTA Theater Military Clinical Desktop includes the following basic navigational components: the menu bar, which consists of pull-down menus grouped by the headings displayed in the menu bar. Options on the pull-down menus are enabled or disabled as determined by user roles and privileges, as well as by which module is currently open in the workspace. Select the Tools menu. The Tools menu includes an option, Startup Options, that permits you to select the AHLTA Theater module that automatically displays in the workplace of the desktop when AHLTA Theater is accessed. The Physician's Shortcuts is a customizable shortcuts list containing icons representing AHLTA Theater modules selected by you. The shortcuts list can be hidden to maximize the amount of screen space. The Toolbar, which is a customizable bar containing shortcut icons selected by the user. The Action Bar is located across the top of the workspace. It changes to display functionality specific to the module or tab displayed in the workspace. The Patient ID bar is located directly under the Action Bar and displays the name and other demographic data for the patient whose record is currently loaded. It also displays allergy, data manager alerts, and special work status icons related to the current patient. The folder list is the primary method for navigating to AHLTA Theater modules and is located to the left of the desktop and contains links to each AHLTA Theater module. The workspace is just that. All AHLTA Theater modules opened by you display in this active module area of the screen known as the workspace. Lastly, the status bar is located at the bottom of the desktop. It shows the currently logged in user, facility, date, and time. From time to time, system messages display in the left portion of the status bar. To see some of these basic navigational concepts, let's perform a basic navigational step. Select Cosigns from the folder list. The Cosigns module appears in the workspace, and the action bar changes to reflect module-specific functionality. To close the Cosigns module, use the Close icon on the action bar. Note, it is a good practice to close modules you are not using, because most newly opened modules open on top of previously opened modules in the workspace of the screen. Keeping multiple modules open drains memory resources and adversely impacts performance. Other open software applications, such as web browsers, can also impact performance. To exit the AHLTA Theater application, select the File menu, and then select Exit. At the Exit prompt, click the Yes button. The Security and Navigation module briefly described AHLTA Theater security, demonstrated logging into AHLTA Theater using a user ID and password, identified AHLTA Theater desktop components and navigation methods, demonstrated opening and closing modules, and logging out of AHLTA Theater. Module 2 will show you how to walk a patient through documenting a theater triage encounter in AHLTA Theater. In a triage setting, emphasis must be placed on rapid decisions and intense interaction between triage team members as the patient's condition is quickly assessed and life-sustaining actions are taken. AHLTA Theater facilitates the efficient documentation of required information that accompanies the patient through the continuum of MHS echelons of care. The learning objectives for the Theater Workflows Triage module include: create a new visit and document a patient encounter utilizing an encounter template. The Patient Search module is used to quickly locate records for registered patients and create visits. Records can be located several ways. Searching for a record utilizing the Social Security number, SSN, is the best way to ensure the correct record is located. You also have ready access to the Patient Maintenance window to register new patients and create records for unknown patients. The Patient Maintenance window is used to enter and update patient demographic data, such as name, Social Security number, family member prefix, FMP, date of birth, race, gender, religion, service, rank, and patient category, PATCAT. You can also document the patient's address and phone in the appropriate tabs. The patient's blood type can be added in the Forensics tab. The Patient Maintenance module allows you to enroll new patients if they are not already in the AHLTA Theater database upon deployment and enter and maintain patient demographic data. The Patient Maintenance window is also used to create a record in the case of an unknown patient and can be accessed from the Patient Search window. The New Visit module is used to establish the type of visit, provider, clinic, and reason for visit. You can also add comments if desired. Quick access is available to the Triage and Outpatient Tracking modules, along with the Patient Encounter. The Triage module allows for rapid entry of injuries and location of injuries and is tied back to the Screening module of the associated Encounter Summary document. You are able to select one of the injuries from the injury list and click anywhere on the images. This displays an icon representing the injury on the selected location of the body, and the system automatically creates a textual description of the injury and location under the injuries listing. The anatomical graphic can be used to locate specific injury types, such as gunshot, laceration, burn, to general locations on the patient's anatomy. Currently, it is not intended to identify every possible part of the patient's anatomy that may be involved. Parts of the anatomy that cannot be seen on the graphic, such as eyes, nose, and mouth, cannot be documented. All such locations are identified by the general area, such as head. Additionally, other locations visible on the graphic are not specifically identified. These areas include knee, ankle, buttocks, and digits, hand or foot. It is imperative detailed, accurate documentation of all injuries be completed in other locations within the encounter. The encounter summary acts as the main documentation area for the patient visit. The encounter is the electronic version of the standard Form 600 or SF 600. The buttons available on the encounter represent the basic steps of completing a patient visit. The buttons include AutoSite, Screening, Vital Signs, Subjective, Objective, SO, Assessment, Plan AP, Disposition, and Add Note. As each step is completed, the information documented is displayed in the appropriate section of the encounter. The AutoSite area includes items such as past vital signs, medications, and any allergies the patient has documented in their record. The AutoSite button on the encounter is used to refresh the AutoSite area. To set your AutoSite preferences in Signature Block, click the Options button on the Patient ID bar once an encounter is opened. The Vital Signs module is used to document a patient's vital signs and review past vital signs. You can document the patient's height and weight, personal habits, patient's subjective assessment of current pain, visual acuity, oxygen saturation, and peak flow results. If you are documenting a visit for a female patient, the Female-Only Data button will be available. This will allow you to document female-specific information relating to birth control and reproduction history. The SO module is used by the provider to document the patient's history of present illness, HPI, past medical history, PMH, review of systems, ROS, physical exam, PE, and test results performed during the encounter. Only the ROS and PE functions are used during a triage setting. The AP module is used to document the patient's diagnosis or diagnoses, any procedures performed during the visit, and the plan for treatment. Additional functionality is addressed in Module 3, AHLTA Theater Clinic Workflow. The Disposition module is used to document the nature of the patient's injury and disposition. Follow-up information, patient understanding of the diagnosis and medications, and the category of injury or illness along with the cause is also documented in this module. After the disposition is documented, the sign icon on the action bar can be used to access the Sign Encounter window. The Sign Encounter window is used to review and sign the encounter. You can electronically sign the encounter by entering your AHLTA Theater password in the password field and click the Sign button. If you want to manually print the encounter, select the Auto Print checkbox prior to clicking the Sign button. The Outpatient Tracking module is used to view visits created in AHLTA Theater and manage the flow of patients through the clinical setting. Visits can be transferred, canceled, and patients can be checked out using the icons on the action bar. The status column within the appointment list reflects the status of the visit from checked in, visit created, to waiting, vital signs recorded, to in progress, SO or AP documented, to complete, where the encounter is signed. The Data Manager is used to download information regarding the completed patient's encounter from the theater LDDB to a writable transportable device, such as a universal serial bus, USB device, that accompanies the patient when evacuated to a resuscitative surgery facility. This module will be discussed in detail in Module 7, Data Manager. A male Army patient, Private Davis Lee, has been transported to your unit by first responders suffering from an apparent gunshot wound to the upper chest. The first responders have applied a pressure dressing and started a saline IV. You need to document Private Lee's injuries using AHLTA Theater. Log into AHLTA Theater using ERDoc as your user ID and ONE $1234567 as your password. To quickly document the patient's injury, select Search from the folders list. The Patient Search window opens. From this window, you can search for patient records or create new patient records. For this simulation, click the New Patient button. The Patient Maintenance window opens. All fields indicated in red and with a red asterisk are minimum required fields. All fields with a black asterisk are TMIP required fields. To register privately, select the last name field and enter Lee. To navigate to the additional fields, you can use the Tab key to tab to the fields or select the appropriate fields. For this simulation, you will be instructed to select the fields. Select the first name field. Enter Davis and then select the middle field. Enter Harvey in the field and then select the SSN, Social Security number. When entering the SSN, you do not need to enter the dashes. AHLTA Theater will automatically insert them. Enter 222-11-3333 and then select the FMP drop-down. Scroll down and select 20-sponsor from the list. Select the birth date field. As with the SSN field, you do not need to enter the dashes. Enter 12301981 in the birth date field and select the race drop-down. Select white and select the gender field. Select male from the list. Next, select the religion drop-down and select American Baptist Church from the list. Next, select the service field and select Army from the drop-down list. Select the rank field. Scroll down and select Private E1A from the drop-down list. Finally, select the patient category, PATCAT, drop-down arrow, and select A11 USAAD enlisted. With all of the patient information entered, click the OK button. You are returned to the Patient Search window with the patient displayed and selected. Note, the X in the Verified column indicates the patient demographic data has not been verified prior to preload, or the patient has been registered in AHLTA Theater. To continue with the visit, click the New Visit button at the bottom of the Patient Search window. The New Visit window opens. First, you need to indicate the visit type. Select the Emergency Radio button. The date and time fields default to the present date and time. To document Private Lee's gunshot wound to the upper chest, select the Search field and enter gunshot wound in the search field and click Find Now. The search results are displayed. Scroll down and expand gunshot wound. Now scroll down and double-click thorax. Gunshot wound of the thorax is added to the selected reasons for visit pane. To document the type and location of the wound, click the Triage button. The Triage module opens. Click the Emergent Priority button and then select gunshot from the injury list. The type, G, and location is documented along with a textual description on the right-hand side. To document the rest of the visit, click the Encounter Summary button. The Encounter Summary displays with the information you documented in the New Visit and Triage modules. The next step is to document Private Lee's vital signs. Click the Vitals button on the left side of the Encounter Summary. The Vital Signs module displays: enter Private Lee's vitals of blood pressure, BP 90/60, heart rate, HR 110, respiratory rate, RR 22, and temperature, temp of 97.8. Start by selecting the first blood pressure field. Enter 90 and then select the second blood pressure field. Enter 60 and select the heart rate field. Enter 110 and select the respiration rate field. Enter 22 and select the temperature field. Enter 97.8. After the vitals have been entered, click the OK button. You are returned to the Encounter Summary with your entries documented in the Vitals area. To continue with the documentation, you would like to load an encounter template. Click the Templates icon on the action bar. The Templates Management module displays, defaulted to the Template Selections tab. Note, the encounter template used in this lesson is one of the pre-positioned enterprise templates provided when AHLTA Theater is installed. To locate the encounter template, select the name search field and enter Encounter. Then click Find Now. The search results are returned. You can double-click Encounter Basic Simple AHLTA Theater Template or select the template and click the Add button. Double-click Encounter Basic Simple AHLTA Theater. Your selection is added to the Selected Templates pane. Click OK. You are returned to the encounter summary. To document the ROS and PE, click the SO button on the left side of the encounter summary. The SO module displays. Select the ROS tab on the left. The ROS tab displays with the terms pre-populated in the selected template. You will learn more about templates in later lessons. You need to indicate Private Lee is experiencing chest and abdominal pain and is having trouble breathing. Let's start documenting. Expand cardiovascular symptoms. And select the large plus sign, positive, next to chest pain. Then expand pulmonary symptoms and select the large plus sign, positive, next to difficulty breathing, dyspnea. Collapse both pulmonary and cardiovascular symptoms. Next, select the PE tab. The PE tab displays. To start documenting the PE, expand General Appearance and Well Appearing. Select the large plus sign, positive, and the large minus sign, negative, next to In No Acute Distress. Now you would like to document the AP. Click the AP icon on the action bar. The AP module opens with the Diagnosis tab defaulted. The AP module will be fully explained in the next lesson, Module 3 AHLTA Theater Clinic Workflow. To document the gunshot wound diagnosis, select the search field and enter gunshot wound and click Find Now. The search results display. Expand gunshot wound 8. Scroll down. And double-click thorax. Your diagnosis is added to the diagnosis pane. To document the IV intravenous catheter placement, select the Procedure tab. The Procedure tab displays. Note, users are cautioned not to select current procedural terminology, CPT codes in the Procedures tab for medications, radiology procedures, and lab information to be resulted at a later time. These items should be selected in the Order Labs, Order RADs, or Order Meds tabs as appropriate. Select the search field. For this simulation, enter 36000 in the search field and click Find Now. The search results display. Select the intravenous catheter placement by double-clicking the term. The procedure is added and automatically associated to your diagnosis. To order the laboratory tests, select the Order Lab tab. The Order Lab tab displays. Select the New Lab Order field. Enter CBC in the search field and click Search. The search results display. Select CBC with AutoDiff from the drop-down list and click Submit. The ordered lab is added and automatically associated to your diagnosis. The order also displays in the Laboratory Orders pane at the bottom of the window. To order the chest X-ray, select the Order RAD tab. The Order RAD tab displays. Select the new RAD order field. Enter chest in the search field and click Search. The search results display. Select chest, PA, LAT. Your selection is added to the procedure name field. Enter GSW for gunshot wound in the clinical impression field and click Submit. Your order is added and automatically associated to your diagnosis. The order also displays in the Radiology Orders pane at the bottom of the window. To order the needed medications, select the Order Med tab. The Order Med tab displays. Select the new Med order field. Enter morphine in the search field and click Search. The search results are displayed. Select morphine 10 mg per milliliter injection. Your selection is added to the item name field. If a SIG is defaulted in AHLTA Theater, it will populate in the SIG field. If not, enter the appropriate SIG. Accept the defaulted SIG. The green plus sign to the right of the SIG allows you to view the applicable dosage range for the selected medication. If a yellow question mark displays, this indicates an incomplete dosage checking. A red exclamation point indicates the SIG created an overdose condition, and a solid gray box without any symbol indicates that it is no dosage information. One is defaulted in the quantity field. Accept the default and click Submit. Your order is added and automatically associated to your diagnosis. The order also displays in the current outpatient medications pane at the bottom of the window. Note, dispensing meds from the AP module is only permitted for outpatient meds. Lastly, you need to document the patient instructions. Select the Patient Instructions tab. The Patient Instructions tab displays. Enter fluids in the search field and click Find Now. The search results display. Expand Fluids and double-click Parenteral Fluids. Your selection is added as patient instructions and automatically associated to your diagnosis. Note, if a term contains an underscore, such as parenteral fluids, underscore milliliters per hour, the value represented by the underscore cannot be entered within the term itself. The values can be annotated either in the SO module or in the comments section under the diagnosis with which the instruction is associated. Finally, you need to disposition privately. Click the disposition icon on the action bar. The disposition module opens. Select the disposition drop-down arrow. The default destination path populates the path field. Click the Path Ellipsis button. Select Referral to field and enter Next Echelon of Care. Select the Yes radio button for Work-Related. Select the Yes radio button for Battle-Related. Select the Category of Injury Illness drop-down arrow, and then select All Other Medical Surgical option from the list. You are now ready to sign the encounter. Click the Sign icon on the action bar. The Sign Encounter window opens. For this simulation, in the Enter Your Password field, type your password, uppercase O, lowercase n, e, uppercase O, lowercase n, e, 12345678, $, and then click Sign. The Outpatient Tracking module displays, showing the encounter status as complete. Now that you have completed the encounter, your next action is to create a personal information carrier, PIC, that accompanies the patient to the next echelon of care. Note, you need a USB data storage device inserted into the USB port. Select Data Manager from the Tools folder. The Data Manager module displays with the patient data already selected. Select the Destination drop-down arrow. Select PIC from the list. The default destination path populates the path field. Click the Path Ellipsis button. The Select Destination Device window opens. You would select the USB device drive from the device drop-down list. Click OK. You are returned to the Data Manager module. Demographics and allergies are defaulted and cannot be changed. Select the Documents checkbox in the Data Set Options pane and click Execute. The Validate PIC function dialog box displays. Click Yes. The transfer function is initiated. When completed, the Transfer Result Report window opens. Click OK. You are returned to the Data Manager module. Remove the USB device from your computer. Click Close on the action bar to close the Data Manager module to return to the Outpatient Tracking module. This concludes the Documenting the Patient's Injury simulation. Click the X in the upper right corner to close the browser window and continue with the training. The Theater Workflows Triage module, you were shown how to document a patient record through a theater triage scenario, from creating a visit for a wounded warfighter to creating a transportable record of the encounter that accompanies the patient to the next echelon of care. You were shown how to create a new visit and document a patient encounter utilizing an encounter template. You were also shown how to transfer patient data to portable media. In Module 3, you will document a patient clinic visit in AHLTA Theater. You will document the encounter using an alternate input method, AIM form, and a template. The learning objectives for the AHLTA Theater Clinic workflow module include: search for a patient in AHLTA Theater, filter a list of visits, schedule a sick call visit, set encounter summary properties, document an encounter utilizing an AIM form and template, and review and update a patient's record. The Outpatient Tracking module enables you to view, manage, and create patient visits. Patient visits displayed are determined by the Outpatient Tracking module filter. These filter settings can be customized and are linked to your user ID. Typical filter settings are as follows: a specific clinic or set of clinics, a specific user or range of users, and a specific date or date range. You can apply any combination of these filter specifications. They can be changed at any time, either by changing the default filter or by temporarily changing the current settings. The appropriate filter specifications for users depend largely on the user's role within AHLTA Theater. In AHLTA Theater, you can set encounter properties to preset data within each encounter. Note, the Encounter Summary Properties window can only be accessed through an open encounter. In the Encounter Summary window, you can customize a range of properties for the encounter document itself, including the second and third lines of the provider's signature block, auto-site preferences, items automatically displayed, auto-print, print every encounter when signed, disposition follow-up, discussed with default, and auto-save SO every blank minute defaults. Use this window to customize the types of patient information pulled into the encounter summary by auto-site. Auto-site information can include active problems, allergies, active medications, and historical vital signs. In effect, auto-site enables you to see whether data from the patient's health record may be a factor in the current encounter. Note, when the vitals checkbox is selected to auto-site, an additional field becomes active. Enter the desired number in the last field and then select the appropriate time period radio button. The Vital Signs module enables you to view, enter, edit, and delete vital signs information for the patient. This module can be accessed in two different areas in the folder list, under Health History and Current Encounter. To just review past vital signs, access the Vital Signs Review module under Health History. If the module is accessed through the current encounter, past vital signs may be reviewed, and vital signs for the current encounter can be entered, edited, or deleted. There are several ways to document a patient visit using AHLTA Theater. Most providers have found it more efficient for their workflow to see the patient first, complete the AP section of the note immediately after interviewing and examining the patient, and then document the SO section of the note. Other workflows are also supported and are a matter of preference. Captain Anna Smith arrives at your clinic with upper respiratory infection, URI symptoms. You need to locate her record, schedule a sick call visit, and then document the visit. You will document the visit first using an alternate input method, AIM form, and then document utilizing the default template. To get started, select Search from the folder list. Select the last name field. Enter Smith in the last name field and click Find. With Captain Anna Smith's record selected, click OK to load the patient record. With the patient record open, notice the patient-specific modules in the folder list. Now that you have selected the patient, you need to set the filter for the outpatient tracking list so you can see the visits you want. To filter the list of visits, click Change Selections. In the Clinics section, select All My Clinics. In the Providers section, select Me to view visits assigned to you. Select Today plus Incomplete. With the selection set, click Set Selections as default to save the filter specifications and to return to the Outpatient Tracking module. With the Outpatient Tracking filter set, you can see your visits for today and you are ready to create the new visit for your patient. Click New Visit on the action bar. The New Appointment dialog box displays. Click Yes. The New Visit window displays. Accept the default of Routine as the visit type. In the Search field, enter cough and click Find Now. Double-click Cough to document the reason for visit to the selected Reasons for Visit pane. Click Encounter Summary to create the visit. Next, you would like to set the encounter properties. For this patient, you want to view active medications and allergies. With the encounter document displayed, click Options, which is located in the upper right of the workspace. The Encounter Summary Properties window opens. In the Auto Site Preferences area, active problems, allergies, and active medications are selected by default. Deselect active problems by selecting the checkbox. Click OK to save the preferences and to return to the encounter document to review the Auto Site information. The Auto Site area has changed to show only active medications and allergies. To set and verify Captain Smith's allergies, you need to return to the Screening module by clicking Screening. The Screening module opens. Click Verify Allergy on the action bar. The Allergy module opens. Captain Smith states she has no known allergies. Select the No Known Allergies checkbox. Then select the Verified This Encounter checkbox. Click Close on the action bar. You are returned to the Screening module. Notice the nose with question mark icon has been changed to an NKA icon. Click Close on the action bar to close the Screening module. You want to enter your patient's blood pressure, heart rate, respiration rate, temperature, peak flow, and female-only data. In the Encounter Summary, click the Vitals button to open the Vital Signs module. On the Vital Signs Module Entry tab, select the first blood pressure field. Enter 120 and select the second blood pressure field. Enter 70 and select the heart rate field. Enter 60 and select the respiration rate field. Enter 16 and select the temperature field. Enter 99.6 and select the height drop-down arrow. Select the feet inches item. Select the first height field. Enter 5 and select the second height field. Enter 4 and select the weight field. Enter 120 and select the peak flow checkbox. Select the peak flow field and enter 405 for the peak flow. To display data fields specifically related to female patients, select the Female Only Data checkbox. The Female Only Data button is disabled for male patients. The Female Only pane is used to document birth control, menstruation history, and information relating to past and present pregnancies. Captain Smith states she is not pregnant and has never been pregnant, uses birth control pills, and her last menstrual cycle was 29th of November 2011. Start documenting her information by selecting the No Radio button associated with Pregnant. Select the Birth Control Pill checkbox. To enter reproductive history of no pregnancies and no children, select the G, Gravid, drop-down arrow. Select 0 and select the P, Para, drop-down arrow. Select 0 and select the A, Abortus, drop-down arrow. Select 0 and select the LC, Live Children, drop-down arrow. Select 0. Next, select Last Menstrual Period checkbox. Select the drop-down arrow in the Data field. And select 29 November 2011 from the pop-up calendar by selecting the Go Back arrow. And select 29. Click OK to save the entered vital signs and close the Vital Signs module. You are returned to the Encounter Summary. To document a diagnosis of acute bronchitis for this patient, click AP from the Encounter Summary. Start by adding the acute bronchitis diagnosis. Select the search field and enter acute bronch and click Find Now. From the search results, double-click Acute Bronchitis. This adds the diagnosis to the documentation in the upper part of the workspace. In addition to adding the diagnosis, you may add comments to document the plan and any justification to support the diagnosis as needed. This action also serves to remind you the next time the patient returns as to what you did for the patient and why. This is done with free text entry. You want to associate a comment with the acute bronchitis diagnosis. Below the listing for the documented diagnosis, select Comment to open a free text box. If the listing for comment is not displayed, select the small plus to the left of the ICD code. This expands the item to display the comment option and any associated orders and procedures if they exist. In the Extended Comments window, enter Suspect RAD Secondary to Acute Infection. Click OK. You are returned to the Diagnosis tab with the comment added. You are ready to document the procedures performed for this patient in the clinic. In particular, you want to document the peak flow test you performed. Documenting in this manner, diagnosis first and then procedure automatically associates the procedure with the acute bronchitis diagnosis. Select the Procedures tab. You need to search for and add peak flow. If you have multiple diagnoses, before adding the term, ensure the correct diagnosis. In this case, acute bronchitis is selected. If not, then select it. By selecting the diagnosis, you have indicated this is the diagnosis to which you want to associate the procedure. Enter peak flow in the search field and click Find Now. Double-click Pulmonary Function Tests Peak Flow 94150. In the Orders and Procedures pane, note the procedure is displayed and it is automatically associated to the acute bronchitis diagnosis in the left pane. To associate a procedure to multiple diagnoses, you would select the appropriate diagnosis in the upper left pane of the workspace, then select the procedure in the Orders and Procedures pane on the right and click the Associate/Unassociate Procedure button. Procedures must be associated one at a time. You have just documented a diagnosis and a procedure for the patient and now need to order a lab test. Select the Order Lab tab. The entry window populates the bottom of the screen. Enter CBC in the search field and click Search. The available tests meeting the entered criteria display in the lab test name pick list. Select CBC with Auto Diff. Any notes or details associated with this test automatically populate the remaining fields. Routine is selected as the default priority option. With the acute bronchitis diagnosis highlighted in the upper pane, click the Submit button located on the tab. The lab test displays in the Orders and Procedures window and associates to the diagnosis. With the lab test submitted, you are ready to order a chest X-ray to make sure everything is normal. Select the Order RAD tab. Enter Chest in the search field and click Search. The available procedures are displayed in the procedure name pick list. Select Chest, PA, and LAT. The clinical impression is a required field when ordering radiological procedures. Enter RO pneumonia in the clinical impression field. Select the Stat radio button for the priority option, and then click the Submit button. The order displays in the Orders and Procedures window. Since the acute bronchitis diagnosis is still highlighted above, this order automatically associates to it. You are now ready to order a medication. In particular, you want to order amoxicillin to treat this patient's symptoms. Select the Order Med tab. Enter amoxicillin and click the Search button. The meds matching the search value populate the item name list. Select amoxicillin, oral capsule, 250 milligrams. The SIG and the quantity are automatically populated with the values entered in the Order Admin module when the formulary was created. Accept the default values and click the Submit button. The order displays in the Orders and Procedures window and automatically associates to the acute bronchitis diagnosis. You would like to document you instructed the patient to drink plenty of fluids and to abstain from smoking. Select the Patient Instructions tab. Select the search field. Enter fluids in the search field and click Find Now. The search results display. Expand fluids. Double-click Oral Fluids. Oral fluids displays in the Orders and Procedures pane and is automatically associated with the acute bronchitis diagnosis. You now need to add the patient instruction to abstain from smoking. Select the search field. Enter tobacco and click Find Now. Locate Anticipatory Guidance, Tobacco Use. Double-click Anticipatory Guidance, Tobacco Use to add it to. Click Close on the action bar to return to the encounter summary. Captain Smith is complaining of a cough and not feeling well. You reviewed the AutoSite information to see if anything relevant is in this patient's history. You have interviewed and examined the patient, and you are ready to document the SO with an alternate input method, AIM form. To load an AIM form, click the SO button. In the SO module, click the Template Management icon on the action bar. Select the Name Contains field, and enter General and click Find Now. Select the AIM, PC, General, AMED, AIM form by double-clicking. The form loads to the desktop. The patient is complaining of a cough, mainly at night, for the past 2 days. You need to enter free text for the patient's reason for visit to include the chief complaint. Select the History of Present Illness free text field. With the Physical Exam tab completed, you can view, in outline form, your SO documentation. Select the Outline View tab. Feeling ill? Yes. Tobacco use? Yes. Alcohol use? No. Caffeine use? Yes. You will now document the ROS using the AIM form. Select the ROS tab. In interviewing the patient, you learn all ROS findings are negative, normal. To document this, click the AutoNeg button on the dashboard. The remaining checkboxes on the ROS tab are automatically selected as No. Note: AutoNeg will automatically select the remaining items on the ROS tab. If you did not ask the patient about all of the items, be sure to deselect those you did not ask by selecting the previously selected No next to each individual item. A dialog box displays asking if you want to accept the change. Click Yes. This will remove irrelevant or unasked items from your documentation. During your examination of Captain Smith, you note she is wheezing. The rest of your examination is normal. Select the Physical Exam tab. Select Yes for wheezing heard in the Lungs section. With the Physical Exam tab completed, you can view, in outline form, your SO documentation. Select the Outline View tab. Expand the different sections to view your documentation. While this is not required, you may view your SO documentation as it appears in the Note view at any time during the documentation process and after you have finished documenting items from the AIM form. To view in Note view, select the Note View button. To view the entire note, close the SO module by clicking Close. The note is documented in the SO section of the encounter. This concludes the Document a Clinic Visit using an AIM form simulation. Click the X in the upper right corner to close the browser window and continue with the Documenting a Clinic Visit using a template simulation. With the SO module open and the default template loaded, select Positive for Visit 4. Then select the Visit 4 free text field and enter cold-like symptoms and press the Enter key. Select the ROS tab. Document cough as a positive finding. Click the ROS HPI button to flip the term to the HPI. On the duration grid located on the dashboard, select 2 and Days. Add wheezing as a positive finding in the HPI. Click the ROS HPI button to flip the term to the HPI. The patient has no fever, chills, or headache symptoms. In the course of the PMH interview, the patient states she smokes cigarettes. She denies a history of bronchitis. Select the PMH tab. Select smoking cigarettes as a positive finding. You will be adding no history of bronchitis later. For efficiency in documenting, avoid trying to document all findings now, unless those history items are on your default template. With the PMH completed, you are ready to move on to document the PE. In the PE, you note that the patient is wheezing. The rest of your examination is normal. Select the PE tab. Add items you have examined, such as positive, general appearance, oriented to time, place, and person. And general appearance, in no acute distress. Negative, nasal discharge. Select negative for cervical lymph nodes enlarged on the right and on the left. Select positive for wheezing. Last, enter negative heart rate and rhythm. With the PE from the default encounter template completed, you are ready to use the DX prompt to add disease-specific symptoms, past history, and physical findings to your note. Click the DX prompt icon on the action bar. The search string window opens. Enter acute bronchitis in the search field and click OK. The Select Diseases for Consideration window opens. From the search results, select Acute Bronchitis and click OK. A list of terms related to your DX prompt now displays in the medicine tree. Select the HPI tab and add positive, a hacking cough, and positive, coughing up sputum. Due to the size of medicine, a list size button can be used to increase the amount of terms visible. The default is list size 1, which contains the medicine terms closely related to the search results. List size 2 presents you with more terms, and list size 3 displays even more terms. Click the list size button on the dashboard to expand the list to list size 2. Click the button again to expand the list to list size 3. Select negative for chest pain or discomfort, and negative, feeling congested in the chest. Select the PMH tab and add negative history of acute bronchitis. Select the PE tab and add negative, rails, crackles wet. With the PE from the DX prompt completed, you might find there are still physical findings that need to be documented. There are several ways to do this. For increased efficiency, use the free text notepad feature to add the physical findings, not on your default template, or that did not show up in the DX prompt. This is also good for those multi-problem visits, as it is not recommended to do multiple DX prompts due to the increased time it takes to document. It is recommended you choose the DX prompt most comprehensive to the patient's reason for visit, and then free text the rest of the exam. To add free text to the HPI section of the note, select the Notepad button in the upper right of the medicine tree display pane. A preliminary background HPI free text window opens. Enter sinus pressure noted, and click Save and Close. The window closes and your text is added to the HPI section of the note. To add free text to the PMH section of the note, follow the steps outlined above, but use the PMH tab instead. Select the Notepad button in the upper right of the medicine tree display pane. Enter No Family History of Asthma and click the Save and Close button. The free text displays in the narrative pane in the PMH sections anchored to a term called subjective. To add free text to the PE section of the note, follow the steps outlined above, but use the PE tab instead. Select the Notepad button in the upper right of the medicine tree display pane. Enter PE complete and click the Save and Close button. When you have entered your note, the free text displays in the narrative pane in the PE section anchored to a term called objective. With the SO completely documented, click Close to close the SO module and view the entire note. You can now complete the disposition and sign. To navigate to the disposition module, from the encounter summary, scroll down and click Disposition. You want the patient to stay home for the next 24 hours. In the Disposition section, select the Disposition drop-down arrow and select Sick at Home Quarters. A new field displays. Select the drop-down arrow and then select the 24 hours option. Accept the no work-related and no battle-related defaults. Select Respiratory from the drop-down list in the category of Injury Illness field. Note, if a patient comes in with a URI diagnosis, for example, the initial visit is captured in the respiratory DNBI category. All subsequent follow-ups for that diagnosis should be captured in the miscellaneous administration follow-up DNBI category. The same holds true for other diagnoses. In the cause of injury illness field, select non-battle illness from the drop-down list. The patient is to return, if necessary, for follow-up. In the follow-up section, select the checkbox next to PRN. The diagnosis and medications were discussed with the patient, and the patient indicated understanding. Use the provided options to document this. In the Discussed section, select Diagnosis and Medications checkboxes. Click the plus button 5 times to enter 30 in the total face-to-face or floor time in minutes field. From the Disposition window, click Sign from the action bar. Enter your password and click Sign. The encounter is signed and its status is updated on the outpatient tracking list. This concludes the Document a Clinic Visit using a template simulation. Click the X in the upper right corner to close the browser window and return to the training. The Documents module provides a single place to view all documentation for a patient, both from outpatient visits and inpatient admissions. It has multiple filters available for organization, with defaults based upon the patient's current status. It is patient-specific, therefore you must have a patient record selected. You have been asked to review Captain Anna Smith's record and add any notes or amend her record as needed. Add a note to Captain Smith's record and then amend her last visit to document her history of asthma. To review a patient's previous visits or admissions, you have to have a patient selected. You can either search for the patient by using the Search module from the Folders list, or if the patient is listed in the Outpatient Tracking module, you can select the patient from there. Captain Anna Smith is listed in the Outpatient Tracking list. Select Captain Smith. Captain Smith's record appears in the folder list. Select the Documents folder. The Documents module opens with all of Captain Smith's inpatient and outpatient visits displayed. You can change the display by selecting the various radio buttons, inpatient and outpatient, the present admission, inpatient only or outpatient only at the top of the module. Since she has only one record, accept the default and select the visit. Her record of the visit displays in the lower half of the workspace. You would like to append or add a note. On the action bar, click the Append Note icon. An encounter note window displays. The current date and time, along with the individual adding the note, are displayed at the top of the window. The next field, Note Category, allows you to identify the type of note you wish to add. You will be adding a progress note to Captain Smith's record. Select the Note Category field. Enter Progress Note and then select the Note Title field. The Note Title field allows you to define the contents of the note. You are adding the results of her chest X-ray for her acute bronchitis visit to the note. Enter acute bronchitis as the note title and select the note field. Enter chest X-ray negative. You would like to include a copy of the X-ray in the note. Click the Load File button. For this simulation, you will add a graphic of the lungs. The graphic is in the Pictures folder. Select the folder and select the lungs.tif file. Then click the Open button. An image preview window opens. If this is not the graphic you would like to include in the note, click the Cancel button. For this simulation, you would like to include the image. Click the Select button. The image is included after the text. Click the Save and Sign button to complete the note. You need to enter your password, uppercase O, lowercase n-e, uppercase O, lowercase n-e, 1 2 3 4 5 6 7 $, in the password field and press the Enter key. You are returned to the Documents module. You can view the note in the Add Notes section by scrolling down the Encounter note until you get to the Add Note. The note is included along with the graphic. Now, let's look at how to amend or update an encounter. Click the Amend Note button on the action bar. The encounter opens. You would like to document that Captain Smith's CBC was normal. Normally, the results would be entered in the Lab RAD Results module. You will be shown how to do this in the Ancillary Modules section of the CBT. Click the SO button. An Encounter SO Notes window opens with a list of Captain Smith's SO notes associated with this encounter. You would like to amend the second note. Select the note and click the Edit Note button. The SO module opens. Select the Tests tab to enter the normal CBC. Next, expand Blood Analysis and Hematology. Select the large minus sign to the left of the blood cell counts. You can view the documentation by scrolling down the note. Click the Close icon on the action bar to close the SO module. You need to sign the encounter again to complete it. Click the Sign icon on the action bar. The Sign Encounter window opens. After reviewing the note, select the Password field and enter your password, uppercase O, lowercase n-e, uppercase O, lowercase n-e, 1 2 3 4 5 6 7 $, then click the Sign button. To close the encounter, click the Close icon on the action bar. The encounter closes and you are returned to the Outpatient Tracking module. Captain Smith's status has changed from complete to updated. This concludes the Review a Patient's Document simulation. Click the X in the upper right corner to close the browser window and continue with the training. The AP module is used to document the patient's diagnosis, procedures, orders, and instructions. The top left of the screen lists the diagnoses along with the International Classification of Diseases (ICD) code, the chronicity and diagnosis type. When displayed, a diagnosis entry includes the name of the diagnosis and its associated ICD code. This is one of the ways AHLTA Theater merges documentation and reporting. The ICD codes are updated periodically with the most current lists. Note, some diagnoses codes require the selection of a DoD-specific extender code. When such a diagnosis is selected, the DoD-specific extenders window opens, enabling you to select the appropriate code. Any procedures, laboratory tests, radiology procedures, medications, and patient instructions can be associated to one or more diagnoses. The buttons located to the right of the diagnosis pane enables you to change the priority of a diagnosis and to associate orders and procedures. The most efficient documentation method is to pick the diagnosis first and then add orders, procedures, patient instructions, and comments. This way, the association is performed automatically, but if you need to make the changes, select the diagnosis and then select the up or down arrow to move it. The Orders and Procedures window contains the list of procedures, orders, and/or patient instructions. To associate orders and procedures to a diagnosis, select the diagnosis, Then select the order or procedure, and finally click the Associate/Unassociate arrow button. The bottom half of the module contains numerous tabs for documenting items. The Diagnosis tab is displayed when the AP module is opened. To find the correct diagnoses, you can use the provided options to view this patient's problem lists or a list of clinic and personal favorites. You can also use the search feature or pick from the default template list if you have a default template set. The Procedure tab allows you to document any procedures performed. This tab is not used to order procedures. The Order Sets tab displays any order sets you have created. The Order Lab, Order Rad, and Order Med tabs allow you to order items from the laboratory, radiology department, and pharmacy. The final tab, Patient Instructions, allows you to document any instructions given to the patient during the visit. An additional tab, Inpatient Order Summary, is available to assist you with notes and orders if your patient is an inpatient. Note, there are only 2 required fields every note needs before it can be signed. At a minimum, each note must have a diagnosis in AP and a disease non-battle injury, DMBI category in disposition. Let's take a look at the SO module. The SO window is made up of 5 main areas: Action Bar, Dashboard, Free Text Area, Medicine Tree, and Narrative Pane. Terms are added to the note using an embedded product called Medicine, which appears as an expandable tree in the left side of the SO workspace. Medicine currently contains terms organized in a series of hierarchies based on relevance and relationships. These relationships contain semantic links that enable you to easily search for the terms you need to document and are used throughout AHLTA Theater outside of the SO module. Other modules that use Medicine include Screening, AP, Diagnoses, Procedures, and Patient Instructions, Disposition, Template Management, and List Management. Use of the Medicine terms equates to structured documentation. As terms are added to the note, they are stored and organized based upon this identifier. At the end of the encounter, AHLTA Theater currently uses these structured terms to assist in symptom surveillance and disease management and decision support. To navigate within the SO module, use the tabs located along the left margin of the workspace. These tabs correspond to the basic functional areas of SO and the sections in the encounter document and note. The buttons on the action bar can assist you in documenting. The dashboard, located just below the action bar in the upper right of the SO workspace, is a sophisticated and essential component of SO documentation. It enables you to add a range of detailed and explanatory information to any term you have selected. The various elements of the dashboard represent different functions for adding to or modifying the selected term. To the right of the SO window is the Narrative pane, which displays the narrative for this encounter based on the terms selected. The narrative, as it appears in this pane, is identical to the narrative that appears in the encounter note. In the Disposition module, you record the disposition of the patient, the DNBI category, and when to follow up. AHLTA Theater automatically calculates the Evaluation and Management (E&M) code for the encounter based on the structured terms and documentation entered in the SO and AP modules. The AHLTA Theater Clinic Workflows module walked you through a patient visit in a clinic. You were shown how to search for a patient in AHLTA Theater, filter a list of visits, schedule a sick call visit, document an encounter utilizing an AIM form and a template, and finally, review and update a patient's record. The AHLTA Theater Inpatient Documentation module will assist you with adding a specialty to a hospital. You will then follow a patient being admitted through an outpatient visit and moving from the battlefield to the hospital. The learning objectives for the AHLTA Theater Inpatient Documentation module includes: add a specialty to the hospital, admit a patient to the hospital specialty, place inpatient orders, record an inpatient progress note, manage inpatient orders, and discharge a patient. AHLTA Theater includes functionality to handle and process inpatient documentation. The inpatient workflow process uses inpatient-specific modules, as well as certain modules used to document both inpatient and outpatient workflows. Through this combination, the inpatient workflow is supported. Setting up the hospital, specifically adding the various specialties needed, is the first step to managing the inpatient population. The hospital setup module allows you to add and manage individual specialties within the hospital. This module is used to create specialties that permit the tracking of patients during the period of their hospital stay. During the initial setup, the Hospital Defense Medical Information System (DMIS) ID is required. This number represents the military ID number for the facility. The hospital setup module is located in the Tools folder in the folder list. This module can be accessed outside of a patient record, and the list of specialties displayed is based on the filter located in the upper right corner of the window. The Inpatient List module, similar to the Patient List module, contains a list of patients currently admitted to the hospital and provides easy management of inpatient documentation. Clinical team members are alerted through the Inpatient List module of pending or unacknowledged orders. The list of patients displayed can be filtered based on specialties, providers, admission dates, status, or bed status. You are at a deployment site that is setting up its hospital. You will be using AHLTA Theater to document all outpatient and inpatient care. You need to create an internal medicine specialty. Also, Captain Anna Smith has arrived at the emergency room, ER, complaining of diarrhea that has lasted for 20 hours. After documenting, you decide to admit her to the hospital. After 2 days, you discharge the patient. Set up the hospital with 5 active and open beds. Then document the outpatient visit for the patient and admit her to the hospital. Document a nurse's and progress note, and after 2 days, discharge Captain Smith. You are at a deployment site that is setting up its hospital. You will be using AHLTA Theater to document all outpatient and inpatient care. You need to create an internal medicine specialty located in the East Wing for tracking any and all inpatients you will treat. Your DMIS ID for this hospital is 3333, and internal medicine houses 5 active and open beds. To add a specialty, select Hospital Setup from the Tools folder in the folder list. The Hospital Setup module opens. Note, on initial setup, the module will be blank. Once you create a specialty, the module will be populated. Click Add from the action bar. The Specialty Setup window opens. Select the Hospital DMIS ID checkbox. Scroll down and select Medical ID. Specialty clinic choices are limited to those in the drop-down list. Select East Wing as the location from the location drop-down. If East Wing is not in the drop-down list, click New Location to add it. Enter 5 in the Number of Beds field. The open checkbox indicates that beds can be selected and filled. The active checkbox indicates whether the clinic is active for inpatients. Click OK. The Hospital Setup module displays with the added specialty. The Edit button allows you to edit the setup. A patient has arrived at the emergency room, ER, complaining of diarrhea that has lasted for 20 hours. The diarrhea is watery and occurs at least once an hour. She denies eating anything that was spoiled and knows of no one else who is or has been ill. As you speak with the patient and complete your PE, you note a diagnosis of infectious diarrhea and admit the patient to the hospital. Create a new emergency visit for Captain Anna Smith with a reason for visit, diarrhea. Open the encounter summary and click Vitals. To document the patient's vital signs of BP 116/60, HR 86, RR 18, and temperature. Click OK to save the vitals and to return to the encounter summary. Open the SO module and complete a DX prompt search on diarrhea. Select Infectious Diarrhea and click OK. Document the following: positive diarrhea. For 20 hours, use free text to add for 20 hours. Positive diarrhea, watery. Positive nausea. Negative vomiting. And positive fever. Click Find Term and search for dizziness. Add dizziness as a positive finding. Click Go Back to access the medicine default tree. Select the PMH tab. Expand Past Medical History, Exposure, and add consumed possible contaminated, spoiled, poisonous food as a negative finding. Click the notepad icon and enter free text for the following: patient has no history of bowel problems. Select the PE tab and click the notepad icon to document the following: patient appears dehydrated. Click OK. Click AP in the action bar and document a diagnosis of infectious diarrhea. 0. In the Disposition module, document the following: disposition, admitted. Work-related, no, defaulted. Battle-related, no, defaulted. Category of injury, illness, gastrointestinal, infectious. And cause of injury, illness, non-battle illness. Sign the encounter. Since you plan to admit the patient, after signing the encounter, the new Admission Direct window opens, allowing you to admit the patient directly from the patient encounter. Captain Smith is being admitted to the medical ICU specialty in the hospital in Bed 3. She is reporting to the hospital directly from the ER, and her primary service is gastroenterology. Select Direct to Reporting MTF from ER as the admission type from the drop-down list. Select Gastroenterology as the patient primary service from the drop-down list. Select Medical ICU East Wing as the specialty. Select Bed number 3. Note: the diagnosis from the outpatient encounter is brought forward into the selected admission diagnosis field. If you need to add another diagnosis, simply perform a search and add the diagnosis to the list. Enter any admission comments if applicable. Click OK. A dialog box opens asking if you want to complete an admission history and physical now. Click Yes to complete admission history and physical. Because you admitted the patient from an outpatient encounter, you have the option to copy forward the information from the outpatient encounter into the inpatient note. This is a valuable tool to assist with the documentation of the admission H&P. The selections made during the outpatient encounter are forwarded to the appropriate modules, SO or AP. All findings selected, either positive or negative during the outpatient encounter, are displayed unselected in the medicine tree in the SO section and are available for selection as desired. Diagnoses made during the outpatient encounter are available for selection in the Diagnosis tab of the AP module. This information can be used for the documentation of the H&P. The provider may use any portion of the outpatient encounter pre-position data or choose not to use any of it. Click Yes to copy forward this information. To document the SO portion, click SO from the Encounter Summary module. The SO module opens with the findings from the outpatient encounter in the medicine tree pane. To enter the outpatient findings into the note, simply add them as positive or negative findings on each of the tabs. For this simulation, you will add the subjective, fever, nausea, and diarrhea as positive findings. You can add additional SO findings as needed. Click AP from the action bar. The AP module opens with the details from the outpatient encounter. Select Infectious Diarrhea 009.2 as the assigned diagnosis. Order the following medications: Pepto-Bismol oral suspension, PO/QID, Cipro 500 milligrams, PO, and lactated Ringer's intravenous parenteral solution. Order the following labs: Cryptosporidium smear, stool, and stool pH. The Inpatient Orders module allows the clinician to view patient-specific inpatient laboratory to radiology, medications, this tab and other orders for the nursing staff, such as take vitals every 4 hours, are not available for viewing in this module, since they are not orders. Different orders, patient instructions and procedures associated with an encounter can be viewed in the AP module. Arrow. Select a patient has arrived at the hospital with an open wound to his back. He was walking with his patrol group when an improvised explosive device, IED, exploded. Select the patient was hit by flying debris, causing the back wound. He is complaining of major pain and leg numbness. The field medic treated with a dressing, splinting, and medication, morphine, 5 milligrams IM, and has an initial suspicion of a cracked vertebra. The patient was forwarded to the field hospital. Upon arrival, the patient stated he was allergic to aspirin. You need to admit the patient directly from the Inpatient List module. Window opens. Review the note and enter your password. Click Sign. The Inpatient List module opens with the encounter highlighted and Orders in the Notice column. Note, the red orders is to alert the nursing staff to review the orders associated with this patient's care. While the patient is selected, the orders will not display in red. The orders must be acknowledged to turn off the alert. A day has passed and Captain Smith is feeling better. As the nurse, you need to add a note pertaining to the patient's progress and acknowledge the orders. Please note, you are logged into the application as a nurse to complete the following task. The note types differ based on your role. With the patient selected, click Add Note from the action bar. The Add Note window opens with the list of available note types. Select Nursing Note and click OK. The Encounter Summary window opens. Click Add Note. The Select Note window opens. Click New Note. The Encounter Note window opens. Enter Nurse Note in the Note category field. Enter Patient has no cramping. Click Note Complete. The note is written to the Encounter Summary module. To acknowledge the orders from the Encounter Summary module, click AP Click the Inpatient Order Summary tab you would select the Nurse Acknowledge checkbox associated to the appropriate orders and click the Nurse Acknowledge button to acknowledge the orders. Click Close from the action bar to close the AP module. Click Sign from the action bar to sign the note and to return to the Inpatient List module. Another day has passed and Captain Smith is feeling much better. It is time to discharge her. From the Inpatient List module, with the patient selected, click Add Note on the action bar. The Add Note pop-up window displays. Select the Discharge Summary option and click OK. The Encounter Summary displays. Document a discharge diagnosis by clicking AP. The AP module opens. Select the discharge diagnosis from her chronic problem list and click Add to Encounter. The discharge diagnosis is added to the top pane in the AP module. Click Disposition on the action bar. The Disposition module opens. Select Released Without Limitations select the appropriate category and cause of injury/illness from the drop-downs. Click Sign on the action bar. The Sign Encounter window opens. Enter your password and click Sign. You are returned to the Inpatient List module. This concludes the Admitting an Outpatient to the Hospital simulation. Click the X in the upper right corner to close the window and return to the training. RR 13, height 5 feet 9 inches, and weight 156 pounds. You are ready to sign the progress note. Click the Sign icon on the action bar. Review and sign the note. A day has passed and you need to document a new progress note. All vitals have been stable over the past 24 hours. Patient is resting comfortably. Discontinue morphine. Start on Tylenol 3 with codeine. Patient is being moved to E4 facilities in Germany. Let's start by adding the new note. From the inpatient list, click the Add Note icon. Select Progress Note. Then close the AP module. Now click the Add Note button on the Encounter Summary. Select the New Note button. Enter Progress Note as the note category and then select the narrative pane. Enter Vital Stable, Patient Resting Comfortably, and then click the Note Complete button. Now select Inpatient Orders from the folder list. Click New Orders. The AP module opens with the Order Summary tab defaulted. Add the Tylenol 3 with codeine by selecting the Order Med tab. Search for and complete the Tylenol 3 order. You notice you do not have a diagnosis to associate the medication to. Locate and add Private Lee's diagnosis from his acute problems list. To associate the medication order with the diagnosis selected, select the medication from the Orders and Procedures window. Click the Associate button. Then close the AP module. To document radiology or laboratory results, select the Order Management module. With the appropriate patient's record selected, click View Edit on the action bar. The Enter Results for Action window overlays the Order Management module. In the Results field, you would enter the results of the selected order and select Result Status Radio button, depending on the result. Click OK. The result is added to the patient's Lab RAD Results module, and the item is displayed as complete. To view the Fill Dispense History log, click Dispense History button on the action bar. The Fill Dispense History log window opens. Click Close to close the Fill Dispense History log window. To print preview and print the label, click Print Label icon. In the AHLTA Labels window, click Preview. The Print Preview window opens. Close the Print Preview window by clicking the Windows Close icon, X, in the upper right corner of the window. Then close the AHLTA Labels window. You are returned to the Inpatient List module. Click the X in the upper right corner to close the window and return to the training. The Order Management module enables you to document the results of all inpatient and outpatient laboratory, radiology, and medication orders, to fill and dispense medications, both inpatient and outpatient, and to have those actions added to the appropriate patient's encounter. As with the Inpatient Orders module, patient instructions and procedures are not included in the Order Management module, and they can be viewed in the AP module. As covered in the AP section, laboratory and radiology orders can also be resulted and medications dispensed in the AP module. Doing so requires the appropriate patient encounter be opened. Resulting orders and filling and dispensing meds in the Order Management module do not require you to first open a patient encounter, thereby streamlining the process. The AHLTA Theater Inpatient Documentation module walked you through admitting a patient from an outpatient service or a direct admission. You were shown how to add a specialty to the hospital, admit a patient to a hospital specialty, place inpatient orders, record an inpatient progress note, manage inpatient orders, and discharge the patient. In Module 5, Template Methodology, you will learn the basic skills and concepts used to create, personalize, and use various templates. You will also learn how to set default templates. The learning objectives for this module includes import encounter and visit templates, create, modify, and set a default encounter template, create, personalize, and use a disease-specific visit template, and personalize and use a pre-positioned encounter template. Before a provider begins documenting patient visits in AHLTA Theater, a generic default encounter template should be set. It is very difficult to document visits using only the disease-specific templates or no template because most patients do not always fit into a template, and providers see a wide range of problems not limited to those included templates. It is not necessary to have many disease-specific visit templates if a single default encounter template is set. The default template methodology allows providers to see almost any type of visit. AHLTA Theater includes pre-positioned encounter templates for providers to use. However, not every provider documents his or her patient encounters in the same style. Providers can use these pre-positioned templates as a basis for creating and personalizing visit and encounter templates to match their style of documentation, or to create new ones as they become more familiar with the system. It is important to remember as you proceed through this module, visit and encounter templates are different. Visit templates contain pre-positioned terms specifically used in documenting the SO portion of the patient visit, such as HPI, PMH, ROS and PE. Encounter templates are used in documenting the patient encounter with pre-positioned clinical data covering multiple modules, SO, diagnoses, procedures, patient instructions, and so forth. The ability to personalize templates allows providers to capitalize on the redundancy of normal answers and standard responses while still reflecting the specific conditions of a given encounter. As mentioned before, it is important for users, especially providers, to set a template as their default before seeing their first patient. Because this is critical to being able to document efficiently when templates are not available, a starter generic visit and generic encounter template have been included. These templates can be set as a default and modified later as time permits. The pre-positioned templates available in AHLTA Theater cover a wide range of symptoms and conditions likely to be seen by healthcare providers and other members of the clinical staff. Symptoms and conditions not included in the pre-positioned templates can be added during the personalizing process. Encounter templates can be accessed via the Template Management module located in the Tools folder. The Template Management module can be accessed with or without an open encounter, but is generally accessed while in an encounter, after the screening process, and before any charting is completed. Encounter templates may be viewed and edited without an open encounter. Encounter templates are used to streamline the documentation process, and each encounter template contains placeholders for diagnoses, procedures, SO notes, templates, patient instructions, auto-cited items, and the associated reason for visit. Once an encounter template has been selected and loaded into the encounter, the pre-positioned lists are available within SO and AP modules. You would like to set an encounter template as your default. Set the Encounter Basic Simple template as your default. In order for you to become the owner of pre-positioned templates and have them located in your My Favorites folder, you must first save them in your My Favorites folder. To get started, select Template Management from the folder list. Select Template Management from the folder list. The Template Management module opens. Click the search icon from the action bar and enter Encounter in the template name field and click Search. Select the Encounter Basic Simple template. You would right-click on the template and select Default Encounter Template. The default encounter template is now set as shown by the words Default Template. This template will load on every visit, every time, starting with the next visit. This concludes the Setting the Default Encounter Template simulation. Click the X in the upper right corner to close the browser window and continue with the training. There are several ways to create disease-specific visit templates. The method for building a visit template is no different than using the skills learned in Module 3, where you use the default encounter template and DX prompt. In addition, you will use Find Term to try to find the items you would have placed in free text. When building a template, it is more important to have those items structured if possible. A general rule to remember is to place all symptoms in the ROS tab. Unless for a particular disease process, some symptoms will generally always be positive or abnormal. The reason this approach is taken is so you will be able to create a note that is easier to read. Generally, the symptoms in the HPI are abnormal and the symptoms in ROS should be normal. There are approximately 300 terms that behave in the reverse of most of the medicine terms. The majority of these terms reside in the PE section of the medicine tree. When these terms are selected as positive, a normal statement is added to the note. When selected as negative, an abnormal statement is added. Again, compare by asking a question. Is the patient awake? Yes, positive. No, negative. AutoNeg, an option located on the SO dashboard, is a powerful tool that can be used to quickly document remaining template terms as normal. It is commonly referred to as AutoNorm. When a reverse sensing term is included in an AutoNeg or AutoNorm action, a normal response is emitted to the note. Reverse sensing terms generally will not impede the documentation process. It is important to ensure that what is written in the note reflects your intention. You would like to create a urinary tract infection UTI visit template to use for your patients. Create a personalized UTI template to document the SO portion of your patient visits. You have reviewed your visit UTI template and would like to modify the template, add additional terms to your template, and resave and test the template. You have reviewed your template and would like to modify the existing visit template. In this example, you will use the Visit UTI template. To further customize your visit template, return to the SO module and click Template Management on the action bar. The SO Template Management window opens. Select the Visit UTI ABC template. The contents display in the right pane. Click Edit on the action bar. This opens the SO Template Edit mode. On the HPI tab, expand the listing for Encounter background information. Select Positive Chief Complaint to the HPI section of the note. Note, in the Template Edit mode, you can only select terms to add to your template by clicking the large plus in the medicine tree. Edit mode makes no distinction between positive and negative findings. The plus means the term has been added to the template. You will, however, be able to select the term as a positive or negative finding when you actually use the template to document an encounter. As you make selections from the medicine tree, they are written to the template contents in the right pane, in the order selected. When the template is saved, the items are reordered by the system as necessary. Click DX Prompt on the action bar. Enter UTI and click OK. Select Urinary Tract Infection and click OK. Enter the following terms to the ROS: decrease in appetite and diarrhea. To the PMH, add history of diabetes mellitus. Select the PE tab and add fever and abdominal tenderness direct to the PE section of the note. On the action bar, click Save to save your changes. Cancel out of the note. Click Close on the action bar 3 times to return to the Outpatient Tracking module. To test your template, you will document a visit by Captain Smith, who is complaining of a UTI. For this simulation, a new visit has been created using UTI as the reason for visit. From the Encounter Summary, click SO to open the SO module. Select your visit, UTI, ABC, from the template drop-down list. The first thing you need to do is enter the chief complaint. Add chief complaint as a positive finding. You can now use free text to add the chief complaint. In the free text field on the SO module dashboard, enter UTI and press Enter on your keyboard to add the free text to your note. You are now ready to further document her ROS. Select the following symptoms: positive abdominal pain, urine frequency increased, and pain during urination. Negative fever, blood in urine, urine cloudy, and pain in flank. With the chief complaint and ROS documented, you are now ready to document the patient's PMH. Select the PMH tab. Document the patient reports she does not smoke and has no prior history of UTIs. You are now ready to document the PE portion of the note. Select the PE tab to document your physical findings. Select the following terms: negative abdominal palpation and positive general appearance in no acute distress. Since you are just testing your template, click Cancel so you do not save the note to the Encounter Summary. When actually documenting the note, you would click Close to exit the SO module and save the note to the Encounter Summary, or click AP on the action bar to save the note. Close the SO module. This concludes the modifying and testing a disease-specific template simulation. Click the X in the upper right corner to close the window and return to the training. The encounter template is a container allowing pre-positioning of documentation elements for an entire visit. Encounter templates contain notes, diagnoses, procedure codes, instructions, and orders. This prevents time-consuming searching for diagnoses and procedures. Parts of an encounter template include associated reasons for visits, associated appointment types, associated problems, items to auto-cite for note, overrides options set in the encounter summary properties window when the template is loaded into an encounter, diagnoses, procedures, note templates, orders, and patient instructions for AP. Default templates can be customized by the user. In this section, you will learn how to search for all available encounter templates and save them as your own. Once saved, you can then modify, edit, and resave them for personal use. The visit portion of the encounter template can also be saved. This is an alternate way of creating and saving visit templates as previously described using the default template and DX prompt. After reviewing the cold and flu encounter template, you would like to add and remove some of the documentation elements from this template and save it as your own. Personalize and save the encounter template. And the Search Browse tab displayed, click Search on the action bar. And the Search Browse tab displayed, click Search on the action bar. The Encounter Template search window opens. To view a list of all available pre-positioned templates, enter %% in the template name field and click Search. The search results would display. Search for your cold and flu template. Enter cold and flu and click Search. With the cold and flu template selected, click Save As on the action bar. The Save Encounter Template window displays. Select Personal from the Save In drop-down menu. The Add to Favorites checkbox is defaulted. Click Save. Select the Template Details tab. You would like to add the visit template you personalized in the SO module to your encounter template, but you first need to remove the note template currently there. Select the template currently in the Note Template section and click Remove. Now, click Add to add the personalized visit template you created. In the Notes Template lookup window, click Search. In the List Note Template search window, enter cold and click Search. Select the visit template you previously created. Click Add Items, and then click Done. Next, you would like to add a diagnosis to the Diagnoses pick list. In the Diagnoses section, click Add. In the Search Term field, enter Upper Resp and click Search. The results are returned. Scroll down and select Upper Respiratory Infection 465.9 from the search result. Click Add Items, and then click Done. You are ready to save the template as your personal encounter template. On the action bar, click Save As. Select the template name field. Enter Encounter Cold and Flu and click Save. On the action bar, click Close. To test your personalized encounter template, let's assume your patient, Captain Smith, has come in complaining of URI symptoms. You do not have a specific URI encounter template, but you can use your personalized encounter template to document the patient encounter. With an encounter open, click Templates icon on the action bar. In the Template Management module Template Selections tab, expand My Favorites and select your personalized encounter template. Click Add. The template is added to the Selected Templates pane at the bottom of the window. Click OK to load the encounter template and to return to the encounter summary. You are now ready to document the SO portion of the note. Click SO to open the SO module. Since your visit template is already included in your encounter template, your visit template automatically displays when you open the SO module. You would use the same procedures as in the Using the Visit Template section of this lesson to document the SO portion of the encounter. Select Positive Visit for and add Cold as free text. Then press the Enter key. You are now ready to document the AP. On the action bar, click AP to open the AP module. Double-click the Acute Bronchitis and Viral Symptom NOS diagnosis from the pick list to add it to the encounter. Select the Acute Bronchitis diagnosis and then select the Procedure tab. Double-click the Pulmonary Function Test Peak Flow procedure. It is automatically added and associated with the acute bronchitis diagnosis. Select the Patient Instructions tab. Double-click Oral Fluids Frequent to add the instruction and associate it to the acute bronchitis diagnosis. On the action bar, click Disposition to open the Disposition module. In the Disposition module, accept the default disposition, released without limitations. In the Follow-up section, select PRN. Select Respiratory in the category of Injury. Select Non-Battle Illness in the cause of injury illness. In the Discussed section, select all items discussed, except the defaulted Patient Indicated Understanding. You can now sign the encounter. On the action bar, click Sign. In the Sign Encounter window, enter your password and click Sign. The encounter is completed. This concludes the Personalize an Encounter Template simulation. Click the X in the upper right corner to close the window and return to the training. The Template Methodology module walked you through importing encounter and visit templates, creating, modifying, and setting a default encounter template, creating, personalizing, and using a disease-specific visit template, and personalizing and using pre-positioned encounter template. The ancillary modules in AHLTA Theater provide information for additional functionality frequently used while documenting patient encounters. Most of these modules are not directly related to a patient encounter, but interface with patient encounter-specific modules. The learning objectives for this module includes add an allergy, add a patient problem, add an over-the-counter OTC medication, enter laboratory test and radiology procedure results into an encounter, and document a military acute concussive evaluation (MACE) exam. The allergy module is used to record and track a patient's reactions to specific allergens. This information is stored using coded data from the Health Data Dictionary, HDD. A common list of allergens can be specified to make entering data more convenient. Data from this module populates in the auto-cite area of the encounter as long as allergies are set to be auto-cited. Every patient has an allergy icon indicating a specific status on the patient ID bar. The three icons are visual indicators to the clinical team members and are defined as follows. NKA, the patient is documented as having no known allergies. Nose, the patient is documented as having known allergies. And nose with a question mark, the patient's allergy information has not been documented. It is common practice to verify the patient's allergies during every encounter by using the Verify Allergies icon in the screening module. In the Problems module, you can add, maintain, and view patient-specific problem information. When auto-cited into an encounter, you can quickly view a list of the patient's past and ongoing problems. These will help you determine whether these problems play a role in the diagnosis and AP for the current encounter. The Problems module displays various information. Problem list, populated with the diagnoses from signed encounters or by manual entry, healthcare maintenance, dental readiness classification, not applicable, and historical procedures, manually entered into the Problems module. Currently, active problems and family history data can be pulled into the encounter via the AutoCite function. The Medications module lists the patient's past and present medications to include all over-the-counter OTC, outside, and AHLTA Theater ordered medications. The list can be viewed, medications reordered, modified, or discontinued, and new OTC medications can be documented. Medications are listed based on the search filter you selected. Caution: do not, under any circumstances, discontinue inpatient medication orders in the Medications module. It is strongly recommended inpatient orders be discontinued in the Order Meds or Order Summary tab of the AP module. The Order Admin module enables you, with appropriate privileges, to establish and maintain a customized formulary of laboratory tests, radiology procedures, medications, and other orders available to providers for selection in the Order Entry module. For authorized users, the Order Admin module is available in the Tools folder. By default, all orders in the AHLTA Theater database are available for selection by the providers. Items in the Other Orders tab are available for inpatients only. Captain Smith has informed you she is allergic to iodine-containing agents and latex gloves, has had acute bronchitis and a tonsillectomy, and is taking Tylenol. While documenting the patient visit, you receive laboratory and radiology results for the patient and would like to enter them in the current and previous visits. Add her allergies, problems, medications, and results to her record. Your patient is allergic to iodine-containing agents and has anaphylaxis as a reaction to the allergen. The patient is also allergic to latex gloves and has both nausea and a rash as reactions. These allergies and reactions must be added to the patient's record. Select Allergy from the folder list. From within the Allergy module, click Add on the action bar. The bottom window displays the fields associated with a new allergy. The allergen and reaction lists are created as favorites by the clinical team members. These lists are set up by clicking Options in the upper right corner of the module. If the allergen or reaction is not in the list, simply click the associated buttons and perform a search. To add the first allergy, select Iodine-containing agents from the allergen drop-down list and select Anaphylaxis from the reaction drop-down list. Patient defaults in the Info Source field. Accept the default and click Onset button. Indicate the onset date 2 years ago by clicking the Go Back less than key, year button. Click OK. Click Save to add the allergen to the patient's allergy list. You also want to add latex as an allergy. Click Add on the action bar. Click Allergen. The Healthcare Data Dictionary search for allergens window appears. Enter latex in the search field. Click Search. Select latex gloves from the search results list. Click OK. The patient gets a rash and is nauseous when she comes into contact with latex. Click Reaction so you can add both reactions. Enter nausea in the search field and click Search. Select nausea and click Add. Enter rash in the search field and click Search. Select rash and click Add. Click OK. Patient defaults in the Info Source field. Accept the default and click Onset button. Indicate the onset date, 1 month ago. Click OK. Click Save. Click Close on the action bar to close the Allergy module. You want to document in your patient has had acute bronchitis and a tonsillectomy. You do not see these listed in the Problems module, so you need to add them to the problem list. To add a problem, select the Problems module. Click Add in the action bar. The selection window appears. The Clinic List tab displays by default. You need to search for a problem. Click Search in the tabs Enter Acute Bronch in the search field and then click Search. And click OK. The status and chronicity of this problem are correct. If you needed to inactivate or change the chronicity, select the appropriate drop-down list and select the correct status or chronicity. For this simulation, click Save. Now you need to add the tonsillectomy. You do not see the procedure listed in the Problems module, so you need to add it to the problem list. To add a historic procedure, click Historical Procedures under the problem list. Historical Procedures is highlighted. click Add on the action bar to perform a search. Select the Search tab and enter tonsil in the search field. Click Search. Double-click tonsillectomy from the list. The status and chronicity of this procedure are correct, so click Save. Click Close to exit the Problems module and to return to the open encounter. In the course of the patient visit, the patient states she's been taking Tylenol. You would like to document this OTC medication so it can be reviewed in future encounters. Select Meds from the folder list. The filter must be set to Outpatient Current to add a med. AHLTA Theater does not currently check for drug-to-drug or drug-to-allergy interactions when OTC outside medications are documented. Click Add on the action bar. On the Select Type of Medication window, click Record OTC Outside Medication. The bottom of the screen displays the fields needed for a new med. Start by clicking Medications. Enter Tylenol in the search field and click Search. Select acetaminophen 325 mg from the search results. Click OK. SIG is Latin for take this way. It is the amount and frequency the med is taken. The SIG-2-PO6QH correlates to take 2 by mouth 4 times a day. Back on the medication screen, enter the SIG for this med. In this case, enter PRN and click Order Start Date button. She started taking the med 1 week ago. Update the start date to reflect she began taking Tylenol on 14 December 2010. Click OK to add the med to the patient's med list. Close the Meds module. In the course of the patient visit, you receive results from the patient's laboratory test and would like to enter them in the current visit. Select Captain Smith's appointment. Click AP button. On the Order Lab tab in the AP module, select the pending CBC with Diff Lab test in the Show Orders pane. Click Enter Results to display the Enter Results for Action window. The reference ranges are displayed in the Results section as entered in the Order Admin module. In the Results section, edit the expected normal ranges to record the following values: WBC 9.2, RBC 5.0, and in the Result Assessment section, select Normal. In the Results Status section, select Completed, Addressed. Click OK. You have also received results from the patient's radiology procedure and you want to enter them in the current encounter. On the Order RAD tab in the AP module, select the pending chest, PA-LAT, RAD procedure in the Show Orders pane. Click Enter Results to display the Enter Results for Action window. In the Results section, enter the following results. Report text: lungs were clear. In the Results Status section, select Completed, Addressed. In the Result Assessment section, select Normal. Click OK. The status of the test has changed in the Order RAD tab. The results are available for viewing in the Patient's Lab RAD Results module. To have the results written to the note, open the Lab RAD Results module by closing the AP module and selecting the Lab RAD module. Select the CBC with Auto Diff Test. The results display in the lower pane. Highlight the results in the lower pane. You would right-click and select Copy to Note from the pop-up menu. View the results in the SO section of the Encounter Summary. Close the Encounter Summary. The Order Admin module allows you to add or modify laboratory, radiology, medication, and other orders if you have the appropriate privileges. From the Order Admin module, click the Add button on the action bar. A blank line displays at the end of the order list. Enter the name of the order. Follow these steps to export order lists. Click the Export icon on the action bar. When the Export an Excel file window displays, select the desired destination and click Save. An Export Completed Successfully dialog box opens. Click OK to close the dialog box. To import orders, follow these steps. Click the Import icon on the action bar. When the Import an Excel file window displays, select the desired file and click Open. The imported file displays at the end of the order list. Close the module to save your added file. This concludes the Navigating the Ancillary Module simulation. Click the X in the upper right corner to close the window and return to the training. The Military Acute Concussion Evaluation, or MACE exam, is a standardized mental status exam used to evaluate concussion in theater. This screening tool was developed to evaluate a service member with a suspected concussion and allows for the identification of clinically relevant neurocognitive impairment. Once the MACE score is documented, it can later be used to determine whether or not there has been a decline or an improvement in cognitive functioning. To be most effective, all service members experiencing concussion or possible mild traumatic brain injury, MTBI, should have the MACE administered within the first 24 hours of the event in order to facilitate the right care at the right time for the service member. The MACE, in combination with a medical exam, can be used to help determine if it is safe for a service member to return to duty. The MACE exam consists of 3 parts: cognitive, neurological, and symptom. The score from the MACE is reported as a combination of all 3 parts. In studies of non-concussed patients, the mean total cognitive score was 28. Therefore, a score less than 30 does not imply that a concussion has occurred. A definitive cutoff score is not available. However, cognitive scores below 25 may represent clinically relevant neurocognitive impairment and require further evaluation for the possibility of a more serious brain injury. The scoring system also takes on particular clinical significance during serial assessment, where it can be used to document either a decline or an improvement in cognitive functioning. This module is used by anyone with privileges and is accessed from the current encounter folder of an open patient encounter. The MACE exam is automatically saved to an encounter and is documented in the Add Notes section. Private Davis Lee bumped his head during his accident. You need to document his first MACE exam depicting his concussive event. Document Private Lee's MACE exam for his 21st of July 2011 incident. A MACE can be accessed through a patient's encounter. For this simulation, you will be documenting the MACE for Private Lee's gunshot wound. Double-click Private Lee's encounter. His gunshot wound encounter opens. Select the MACE folder from the folder list. The MACE module opens. At the top of the module, the current date and time displays in the date of injury and time of injury fields. These items should be changed to document as close as possible the date and time of the injury. To change the defaulted data, you would select the appropriate field. For this simulation, you will change the date to 19th of December 2011 and the time to 06:28 hours. Select the date of injury field. Select 19. Click the time of injury down arrow twice to set the time of injury to 06. As you are documenting the MACE, any questions or items in red are required. As you answer some of the questions, additional items may become available. Let's get started. The first question is this the first screening following exposure to a potentially concussive event? For this simulation, select the Yes radio button. The MACE consists of 14 items broken down into 6 tabs. The first tab, History 1 through 3, is the default tab and contains the first 3 items. Item 1 asks you to ask the patient to describe the incident and tell you what they remember. Private Lee remembers receiving a gunshot wound to the upper chest and then nothing until arriving in the emergency room. Select the What Happened field. Enter Patient received GSW to upper chest in the field and select the Tell Me What You Remember field. Enter Patient remembers being shot and then nothing until in the ER. Select the Yes radio button to indicate the patient was dazed, confused, saw stars. And Yes to Did You Hit Your Head? The second item asks you to identify the cause of injury. Select the gunshot wound checkbox. Next, select the Yes radio button to indicate a helmet was worn. Two new fields display, Type and Other. Select the Type drop-down and select Kevlar/ACH from the list of available helmets. You can select the second tab, History 4 through 7, or click the Next button to continue. Click the Next button. Item 4 asks if the patient had amnesia before the event occurred. Select the No radio button. The patient is now asked, are there any events just after the injury that are not remembered? Select the Yes radio button. You need to describe what the patient does not remember. Select the Note field and enter Patient does not remember being brought to ER. The length of the amnesia needs to be documented. Select the If Yes, How Long drop-down. Select 0 to 24 hours from the list. Next, select the Yes radio button to indicate the patient reports a loss of consciousness or blacking out. The length of time again needs to be indicated. Select the If Yes, How Long drop-down and select 0 to 30 minutes from the Item 7 asks if anyone observed a period of loss of consciousness or unresponsiveness. Select the Yes radio button. Select the If Yes, How Long drop-down and select 0 to 30 minutes from the list. To move to the third tab, History 8-9, click the Next button. Item 8 asks the patient if they have had any concussions in the last 12 months. Select the No radio button. Any symptoms that the patient has need to be documented next. Check all that apply. For this simulation, you will document Private Lee has a headache and memory problems. Select the Headache checkbox and the Memory Problems check. On tabs 2 through 6, you can click the Next button to move to the next tab or click the Previous button to return to the previous tab. Click Next. You will document the examination portion of the MACE next. On this tab, you will evaluate the patient orientation and immediate memory. For Item 10, you would have the patient tell you the month, date, day of the week, year, and time. Select the checkboxes to the right of every item they have correct. Private Lee was able to recall the correct month, December, and year 2011. Select the December checkbox and 2011 checkbox. For Item 11, you would read all 5 words to the patient and then have the patient try and recall them. They can recall them in any order. You should repeat this 2 more times for a total of 3 trials. For every one they recall, they will receive 1 point. For Trial 1, Private Lee remembered the candle, paper, and sandwich. Select the appropriate checkboxes for Trial 1. For Trial 2, he recalled all 5 items. Select all checkboxes for Trial 2. For the last trial, Trial 3, he recalled all but the sugar. Select the checkboxes for candle, paper, sandwich, and wagon. Private Lee's immediate memory test score is 12 out of 15. Click the Next button to continue. The Examination 12 tab allows you to document the neurological screening portion of the MACE. As the clinical condition permits, you would check and record any abnormalities. First, let's document the eyes. Both Private Lee's pupillary and tracking responses are normal. Select the Normal radio button for both. His speech fluency and word finding are also normal. Select the Normal radio button for both. His motor skills are next. Select the Abnormal radio button to indicate an abnormal pronator drift. Select the Normal radio button for gait and the Abnormal radio button for coordination. Click the Next button to complete the MACE. Item 13 checks Private Lee's concentration. You read a string of 3 digits, and Private Lee was able to recite back to you the string in reverse order. Select the checkbox beside 493. He was able to recite the second string as well. Select the 629 checkbox. He was unable to repeat the 4-digit string or recite the months in reverse order. His concentration total is 1 of 5. You will document his delayed recall next. Private Lee was able to recall the candle, paper, and sandwich from earlier. Select the checkboxes to the right of these items. His delayed recall total score is 3 of 5. You have completed documenting the MACE for Private Lee. Click the Save and Close button to close the MACE module. The MACE is documented in the Add Note section of the Encounter Note. Scroll down the encounter to view the MACE. This concludes the Documenting a MACE simulation. Click the X in the upper right corner to close the browser window and continue with the training. In this module, you learned how to add an allergy, patient problem, and an over-the-counter OTC medication, enter laboratory test and radiology procedure results into an encounter, and document a MACE exam.